chest pain doesn't always indicate heart attack or heart disease. It can be due to other causes such as respiratory, that is lung, gastrointestinal, that is stomach, muscular or psychological issues. But even if your case ends up not being heart related, you should never ever ignore it. Let's look at some of the most common issues, starting with heartburn. Despite its name, heartburn or acid indigestion is related to your esophagus, the tube that connects your mouth to your stomach. Because the esophagus is located near the heart, many people mistake heartburn for chest pain and vice versa. Heartburn is caused by stomach acid rising up into your esophagus and can sometimes radiate pain to your neck, throat, or jaw. It is actually a symptom of gastroesophageal reflux disease, or GERD. You can reduce the symptoms of GERD, such as heartburn and acid reflux, by avoiding alcohol, cigarettes, anti-inflammatories like ibuprofen, and citrus, which relaxes the valve between the esophagus and the stomach and makes it easier for acid to splash up. You can also raise the head of your bed if you have heartburn at night to allow gravity to help keep your stomach contents down. Another cause of chest pain is angina, which is discomfort caused when your heart muscle doesn't get enough blood. It is a precursor. It is the thing that might come before a heart attack, and so it can feel just like what I described earlier: squeezing, burning, heaviness or pressure in your chest, shoulders, arms, neck, jaw, abdomen, or back. Some people experience other symptoms like shortness of breath or fatigue. Angina happens because one or more of the coronary arteries is narrowed or blocked by a buildup of plaque. There are several different types of angina. The most common, stable angina, usually occurs during physical activity or emotional stress. Unstable angina is more severe and can occur with minimal activity. This may be a warning sign of an impending heart attack. Call 911. Variant angina is rare and due to spasms in the coronary arteries, while microvascular angina affects the tiny blood vessels that branch off from the main arteries. If you are diagnosed with angina, it's really important to know what type you have. If it's unstable, you may need emergency medical treatment to try to prevent a heart attack. The other types of angina can often be managed with lifestyle changes such as healthy eating, regular exercise, and quitting smoking. Your doctor may also prescribe medications to relieve symptoms and prevent future episodes. Surgery may be necessary to restore consistent blood flow to the heart, and that would be a decision made by you and your healthcare provider. Other treatments include cardiac procedures to open blocked arteries, medicine to help keep the arteries open or treat risk factors, cardiac rehabilitation, and again, lifestyle changes. These treatments will not only reduce the pain and discomfort of angina, but they will also lower your risk, the chance for a heart attack, by treating the underlying cardiovascular condition or conditions. Another cause of chest pain is coronary artery disease, or CAD. CAD is due to a buildup of plaque inside the coronary arteries. The plaque, I like to call it stuff that is where it doesn't belong, consists of cholesterol, fat, calcium, and other substances that accumulate on the inner walls of the arteries and cause them to become stiff and narrow. There are many risk factors that contribute to coronary artery disease, including high blood pressure, which damages the inner lining of the arteries, making it easier for plaque to build up; high cholesterol levels, which also leads to plaque buildup; smoking, which increases the risk of blood clots; diabetes, because high blood sugar levels damage blood vessels; obesity; family history of early heart disease; age and gender, that is, are you a man or a woman? The risk of CAD increases with age, and men are generally at higher risk than women. Other risk factors for CAD include sedentary lifestyle. Let's unpack that. That means not moving your body as much as you ought to move, otherwise known as being a couch potato. Stress and diets high in saturated fats and trans fats also increase the chance of CAD. You can reduce your risk of CAD with changes in lifestyle, such as eating a healthy diet, regular exercise or physical activity, and quitting smoking. There are other conditions that can cause chest pain, such as pulmonary embolism. That's when a blood clot blocks blood flow to the lungs. Pericarditis. That's when the lining around the heart becomes inflamed and keeps the heart from being able to pump fully. Aortic dissection, which is a tearing of the aorta, a major artery that delivers blood to most of your body. Aortic stenosis, which is a narrowing of the heart's aortic valve. Hypertrophic cardiomyopathy, which is a disease of the heart muscle. Muscle strains or rib injuries, lung infection, or anxiety or panic attacks. All of these major conditions are serious and require intervention from healthcare professionals. Key takeaways: chest pain is a serious matter. You should never, ever ignore chest pain. Don't self-diagnose. Call 911 or call your healthcare provider for guidance. Chest pain doesn't always indicate heart attack or heart disease. It can be due to other causes.